Okay.
Good morning.
Good morning. Sorry for the delay. We are going to get started. Okay, so I'm gonna gavel in I'm calling this hearing to order. For the record, my name is Julia Mejia, City Councilor at Large. I am the chair of the Boston City Council Committee on Small Business and Workforce Development. We are joined by the sponsors of this docket, Councilor Liz Braden of District 9 and Councilor Ed Flynn of District 2. We're also joined by my colleagues, Councilor in the order of arrival, Councilor Kenzie Bach of District 8 and Councilor O'Malley of District 6. The City Council will be conducting this hearing virtually via Zoom in accordance with Governor Baker's March 12, 2020 executive order. This enables the City Council to carry out its responsibility while adhering to public health accommodations. Okay, sorry. And ensuring public access through adequate alternative means. The public may watch this meeting via live stream at www.boston.gov/city-council-TV. It will also be rebroadcasted at a later date on Comcast Channel 8, RCN Channel 82, and Verizon Channel 1964. We will also take public testimony at the end of the hearing. If you are interested in testifying, please email ron.cobb@boston.gov for the link and follow along on the live stream to know when it's your turn to speak. We will ask that you please state your name and affiliation and residency and limit your comments to 2 minutes to ensure that all comments and concerns can be heard. Today's hearing is on docket 0666, order for a hearing regarding the occupational presumption of COVID-19 exposure for essential frontline workers. Our expected speakers today include Ellen McInnes, RN of St. Elizabeth's Medical Center and the Massachusetts Nurses Association, Darlene Lombos, Executive Secretary Treasurer of the Greater Boston Neighborhood Labor Council, Filaine Deronnette, Vice President of Health Systems at 1199 SEIU, United Healthcare Workers East, Jody Surgan-Buzan, Executive Director of Mass Kosha, Jim Carajo, Political Director of UFCW Local 1445, Henry DeGroot, Executive Director of the Boston Independent Drivers Guild, Roxanne Rivera, Director of SEIU 32BJ Local 615. I will now recognize the docket sponsors for opening statements before turning this over to our panelists. Councilor Breeden, you now have the floor.
Good morning, Councillor Mejia. Thank you so much for chairing this important hearing this morning. I thank Councillor Flynn for co-sponsoring this important hearing on the need for an occupational presumption of exposure to COVID-19 for essential frontline workers. And I also want to extend my thanks to all the panelists who have agreed to come this morning and testify on this important matter. We know you're incredibly busy at a very difficult time as we ramp up to returning to work and across the city, and there's lots of issues to be dealt with. So thank you so much for taking time to come this morning. As we are in phase 1 of the governor's reopening plan, we are still in the midst of a public health crisis, a public health emergency here in the city of Boston. We must ensure proper safety precautions are in place for all people returning to work, but especially for those essential workers who've been working on the front lines all along. These workers are the nurses, healthcare workers, grocery store workers, rideshare drivers, janitors, cleaners, emergency healthcare providers, and many more, and all have put their health on the line to provide essential services at this difficult time. There are countless stories of frontline workers contracting the coronavirus while on the job and bringing it home to their families. Some workers have even died after coming in contact with the virus at work. Unfortunately, some employers refuse to acknowledge the presumption of exposure and contact in the workplace. And so the purpose of, I've called this hearing this morning to really get a better understanding of what our workers are encountering in the workforce and the front lines. And I look forward to hearing from the labour community and advocates on what is being seen in the front lines and how we can support their efforts at the city level going forward. And thanks again so much for being here.
Thank you, Councillor Breeden. I also would like to acknowledge that we have been joined by my colleagues, Councillor Flaherty at large, Councillor Wu at large, Councillor Andrea Campbell, District 4, Councillor Anissa Sabi-George at large, and Council President Kim Janey, District 7. I'd like to now invite the co-sponsor to give some opening remarks. Councillor Flynn, you now have the floor.
Thank you, Councillor Mejia, and thank you, Councillor Breeden, for your leadership on this important issue. I'm proud to partner with you, Councillor Breeden, on this hearing to protect our nurses, other essential frontline workers, and to thank Councillor Mejia as well for chairing this meeting. Our healthcare workers, our first responders, grocery employees, other essential frontline workers are providing critical services to all of us in this pandemic. Many of them have now tested positive for COVID-19 because of their jobs. So it is concerning to us that a number of hospitals argue that healthcare workers who test positive for COVID-19 got the virus in the community rather than at work, even though there are many reports that healthcare facilities still have shortages of PPE and that COVID patients are not separated correctly. We should have occupation presumption for all of our frontline workers, which is the presumption that when a worker gets infected by COVID-19, that they got the virus because of their job. It is critical and only right for us to look to protect the safety and security of our frontline workers. Those are the people bravely protecting, taking care of us, including advocating for occupational presumption is critical. I look forward to this discussion today. I want to thank the panelists for your tremendous work in advocating for respect and dignity in worker protection. And it's outrageous, absolutely outrageous for a company to deny anyone a claim that they didn't get COVID-19 on the job. For just as an example, for a nurse working a 14 or 15-hour shift, 6-7 days a week, and for a hospital to say that that nurse didn't get COVID-19 at the hospital, it's outrageous. So that's where I'm coming from. Again, want to say thank you to the frontline workers and our labor leaders that are here today. Thank you, Councillor Mejia. Thank you, Councillor Breeden.
Thank you, Councillor Flynn. I'd like to now turn the conversation over to those who are living the realities and doing the work. And I'd like to invite Ellen McInnes. You now have the floor. You have 5 minutes for your opening remarks. And you may want to—
Thank you, Chair Mejia. Thank you so much. Thank you to all of you who are doing that hard work on the Committee for Workplace Development. My name is Ellen McInnes. I'm a registered nurse. I live in Boston, and I work in the emergency department at St. Elizabeth's Medical Center. I submit this testimony to you in support of occupational presumption resolution pending before this committee. All frontline workers across all the different industries supporting our society and our patients during this time have been exposed to COVID-19 as a result of their work and conditions associated with their work. However, I'm going to focus my testimony on the healthcare sector, my personal experiences as an emergency department nurse right here in Boston, and the experiences related to me by nurses and healthcare workers across the Commonwealth. We entered this pandemic unprepared. We can debate the hows and whys and how that came to be, and that's certainly outside the scope of this setting. But what we do know is that we did not have enough PPE, personal protective equipment. We did not, hospitals did not properly isolate and segregate patients. And the hospitals have not done a good job of tracing patients and the disease through the patient population. In some cases, the hospitals actively lobbied to lower the CDC infectious disease standards. Most importantly, the standards for personal protective equipment. This left frontline workers like me vulnerable. We weren't given appropriate N95 masks, and when we were able to get one, we were told we had to use it. Currently, the procedure at St. Elizabeth's is a nurse is required to reprocess an N95 mask up to 10 times. So that's over 120 hours of use of breathing into the same device. And I'd like you all to note that none of the manufacturers of these masks have signed off on any of the cleaning processes that are being used. These masks are only supposed to be single use. The hospitals have delayed implementing directives that all employees should wear masks and segregate patients. That was early on. We were told, don't wear masks, it frightens patients. Well, we now know that that's when a lot of people got infected. As all this was going on, the governor made this dramatic stay-at-home order and said there shouldn't be more than 10 people gathering. And yet the Boston hospitals kept putting nurses and other healthcare workers on these shuttle buses and shuttling them in from parking lots miles away. And mind you, these buses pulled up to disperse patients in front of empty garages. We at St. Elizabeth's asked management, since we don't have any visitors and you're on a skeleton workforce, can our nurses and nursing assistants and cleaners and people like that park in the garage? And no, the answer was no, we've never gotten to do that. But for the efforts of Representative Honan, who got us spaces down at Mount St. Joseph, and the mayor, who got us 75 spaces at Brighton High, you would still have 15 or 20 people crammed onto these buses. And actually, I think we submitted a photo of one of those crowded buses to the council. Meanwhile, we started to hear from the hospitals that if you work for the hospital and you became sick, that more than likely you acquired that sickness out in the community. My very dear friend became COVID positive, and her experience is personally related to me, is that of many, many other people. When the tracer from St. Elizabeth's called her, she asked her if she had been out of her house, done any of her own food shopping, gone into a coffee shop, met with any family, met with anybody. So clearly the tracer was pointing away from a workplace exposure and toward a social exposure, which is just absurd. I mean, my friend was working in the clean ICU, the COVID-free ICU without PPE because they weren't provided with it when she got sick. And she wasn't going out to coffee shops or socializing with family or anything like that. We've all been very, very conscientious of protecting the public from potential exposures. And now clearly the hospitals have some responsibility, but they're trying to walk away from that. And that's why I came here today. That's why I want to offer you this testimony. We need, those of us on the front line, we need our elected officials, we need you all to acknowledge and get the hospitals and the industry to acknowledge that if somebody gets sick, that if somebody works with COVID and becomes sick, they got that at work. They got it on something like a crowded shuttle bus or a unit where there wasn't enough PPE, or where we were forced to reuse our PPE, not at Dunkin' Donuts. And this helps us immediately. This helps people access workers' compensation insurance. But passing occupational presumption will also offer some long-term protections, because we don't know what will happen 5 or 10 years from now. We have seen patients with severely damaged lungs, and we don't know what the health sequela of this will be. So permitting folks like us to access workers' comp now due in presumed based on occupational presumption will give us more certainty in the future. So I ask you today to pass the resolution. Frontline workers in the city, across the Commonwealth, across the country really need this. Thank you so much.
Thank you. Thank you. Ellen, I just wanted to acknowledge that I did not give my colleagues an opportunity for opening statements, but I promise you that when it's your turn to ask questions, we will allot for more time, just because some of our panelists will need to leave a little bit earlier, and I want to make sure that everyone has an opportunity to speak. Is that okay?
Yes, of course. Yes.
Thank you. Thank you. Thank you. Okay, so we're gonna now move on to Filaine. And if you could please correct me and pronounce your name correctly, and I'm sorry for mispronouncing your name, but I am trying really hard to do it phonetically here. Filaine, you now have the floor.
Thank you so much, Counselor. Good morning, honorable City Council members, and good morning to my fellow panelists. My name is Filaine Deronnette. Oftentimes I say Elaine with an F because it's easier to say phonetically. And I am here representing 1199 SEIU workers as Vice President of Health Systems. Thank you for holding this extremely important hearing, and I really appreciate the opportunity to speak on behalf of the frontline healthcare workers of 1199 SEIU. Just by way of background, 1199 represents 65,000 healthcare workers across our state in nursing homes, hospitals, and community health centers, and in home care. We represent thousands of members across this great city of Boston as well. And so the workers I'm going to be speaking of are, anywhere between our housekeepers, our registration clerks, our front desk receptionists, medical assistants, rad techs, surge techs, LPNs, RNs, and many other workers who oftentimes are unseen or unheard. This morning, I'm here to discuss and testify on this issue of occupational presumption for healthcare workers and really all essential workers. During this time, many workers have had their commitment to healthcare tested. Coming to work did not only mean serving the patients in the community, it also meant possibly not being provided the adequate PPE, in some cases, the ultimate risk of being exposed to COVID-19. Many dozens of our members have been exposed. And being diagnosed meant that they've underwent, horrific physical symptoms and pains of the virus, emotional symptoms of being quarantined from family and friends, and then sadly, having to have the worry of running through and sometimes depleting their earned time for the first time, and sometimes even subsequent exposures after that. As we know, healthcare workers and other employees have been left out of the federal provisions that ensured additional sick time and paid leave during this pandemic. And what's worse, our members are experiencing this gap in the safety net. So we have to do more for these workers, not less. By way of example of some of the real what's happening on the ground, we have a patient registrar, for example, in the COVID department, had a bad cold and was tested for COVID at the end of March. She was automatically placed out of work for 3 days, which was deducted from her earned time. Thankfully, her test came back negative. This month, same patient registrar has bad allergies. However, the physician in her unit, which I would say rightfully so, considering the pandemic that we're in, asked that she be tested again. And so then automatically another 3 days for the testing period of her earned time lost. Again, thankfully, she tested negative both times, but this patient registrar with young children is left in the negative for bank time. Another example of a medical assistant whose responsibilities include specifically screening and swabbing of patients in the COVID unit. had her symptoms and was tested in April. 3 of her days were depleted, but unfortunately her test came back positive. And so now she's automatically placed on quarantine for 14 days. So in total, 17 of her earned days automatically depleted. We have a MICU nurse that works in a hospital, a well-known hospital in Boston. She's reassigned to the MICU to care for COVID patients as part of the surge planning. She tested positive in April 28th and out for 5 shifts. She's cleared on May 11th and went back to work. Then after feeling great for almost 3 weeks, she started having fevers all over again and all the symptoms, went to the ED and was again positive. She is still out as we speak today. In 2 of these cases where workers' comp could have applied, some were denied and others were even dissuaded from applying. Employers are assuming that these exposures are not their responsibility. I actually had an employer tell me that their medical experts have advised them that community exposure outweighs the risk of exposure in the facility. Now that's ridiculous. The examples I gave were from workers at hospitals, in and around COVID units, in and around COVID patients. The last thing that these workers need to have on their minds is the fear of getting sick, losing their time, having workers' comp being rejected and having the burden of proof on them. This is unacceptable for any healthcare worker who has remained committed to caring for residents, patients, and consumers during this time. Massachusetts is at the epicenter of the pandemic and must create protections for workers most at risk of exposure. Further, workers' comp is job protected time for workers who are out due to COVID-19. So again, we must build a safety net for workers who are on the front lines of this pandemic, both now and if it has to be in the future as well. Mm-hmm. And we must show workers that we recognize the risk that they take to continue to deliver the care to our most vulnerable residents. So I thank you for allowing me to share our concerns and for your support on this critical issue for workers throughout our industries. Thank you again.
Thank you. Thank you so much. I wanted to also just give everyone an FYI, when you hear the sound, that is when your 5 minutes are up, but you can finish your last thought. And this is a very critical issue, and I understand the importance of it. So I will let you continue, but if we can keep our comments to 5 minutes so that we can have an opportunity to let everyone speak. And I know that my colleagues have some questions as well. So I am going to move on to our next panelist, Darlene Lomos. You now have the floor.
Thank you so much. Thank you to the Committee on Small Business and Workforce Development, Chair Mejia, and Councilors Flynn and Breeden for inviting me to testify at this hearing this morning. It's so lovely to see so many of our labor leaders here on this Zoom call. Filaine, I hate speaking after you, so I'm going to give it a go. I'll go a little bit shorter so that you can hear directly from some of our unions who are on the front lines with their members. Again, my name is Darlene Lomos, and I'm the Executive Secretary Treasurer of the Greater Boston Labor Council. We represent 100,000 working class people and their families in the region, and on behalf of the Labor Council, we would like to go on record that all essential workers who have been and continue to report to work and risk their lives outside of their homes and contract the coronavirus must be presumed to have gotten it from exposure at work. The COVID-19 crisis has cast a new light on the value of the labor furnished by workers who have gone unseen for too long within our society and who are now, at long last, being broadly recognized as essential. These same workers, healthcare providers, nursing home aides, bus drivers, first responders, grocery store workers, they have all been chronically underpaid and undervalued by large employers that have always been more concerned with their bottom line than with the common good. The crisis has shown us that it is our labor that drives the economy and creates prosperity. And it is workers, not CEOs, who are out there risking our lives on a daily basis during this pandemic. Therefore, we must prioritize what workers need, not what large corporations want, because there is no dollar earned worth more than a human life. While Congress debates the passage of a National Essential Workers Bill of Rights, unions have acted decisively to support their members through collective bargaining and to push for bold legislation to expand these protections to public and private sectors, all workers. The National AFL-CIO is suing the Occupational Safety and Health Administration, OSHA, to issue an emergency temporary standard aimed at protecting life and the life and health of millions of workers throughout the United States who are in grave danger from the deadly COVID-19 pandemic. As the economy reopens and people return to work, person-to-person contact will increase, and health experts predict the already shocking number of infections and deaths among workers will rise. Locally, the Massachusetts AFL-CIO, the Greater Boston Labor Council, and many of our allies here on the call today, MassCosh, have been pushing for occupational presumption legislation that would ensure that infected essential workers would not have to use their own paid time off or sick time to quarantine, treat, or recover from the coronavirus, and that they and their families get the workers' compensation and death benefits they deserve should their illness become severe. 15 states have already signed into law some sort of occupational presumption legislation, and there have been a few bills filed in the State House that have already received tremendous support from the Walsh administration and could now use your support at the Boston City Council. HB 4611 would cover all individuals employed and considered as first responders. HD 5050 would cover all public employees. HD 4949 would cover EMTs and emergency room or urgent care personnel. And most importantly, HD 5070, an act creating a presumption of relatedness for essential workers suffering from COVID-19, would cover virtually every essential worker, both public sector and private sector. So while it's really difficult, I think, on the city level to figure out what can be done, resolutions are great and can be useful, but what we really need is actually statewide action and statewide legislation. And we really need the City Council with the Walsh administration to really push up against the governor, who does not want to protect workers at all. Lastly, I just want to say on record, as the first woman and person of color to be elected and have the honor to lead the Greater Boston Labor Council at this particular moment in history, I am so proud to work with the first majority women and people of color Boston City Council, and with a mayor who actually comes directly from the labor movement. Now more than ever, we need all of us to bring our unique perspectives, experiences, and skill sets to ensure we advance our struggle for justice and work towards that new world we know is possible. And we need to sharpen our analysis and take action to expose the large corporations and individuals who work intentionally to divide us and want to go back to business as usual. So I want to thank you again for the opportunity to testify this morning, and I'm looking forward to continuing our fight for the safety, health, respect, and dignity of all workers as we build this new normal together. Thank you.
Thank you, Darlene. That was good. That was, you got this. Thank you so much for your remarks. I really do appreciate it. And as a city councilor who's an activist, I feel the sense of urgency and fire and the importance of us acting with intentionality. So really do appreciate this conversation. I am now going to ask our next panelist, Jody Sugarman-Brozan, the Executive Director of MassCosh. You now have the floor.
Thanks so much. Yes, my name is Jody Sugarman-Brozan. I'm the Executive Director at the Massachusetts Coalition for Occupational Safety and Health, or MassCosh, and I live in Rosendale. We work to ensure that all workers can go to work, earn a fair wage, be treated with respect and dignity, and return home to their families alive and well. Thank you for the opportunity to testify at the hearing today, and especially to Councilors Braden and Ed Flynn for ordering the hearing, and to Councilor Julia Mejia for inviting me to be here. Thank you. Since Governor Baker ordered all non-essential businesses closed, essential workers in Massachusetts have tended to the sick, kept us fed, driven our buses, cared for our elderly, and more. We call them heroes, but when they fall in the line of duty, where are we there for them? Workers' compensation is the system designed to take care of workers hurt or killed on the job. Until recently, America's workers could rely on a compact struck at the dawn of the industrial age. They would give up their right to sue. In exchange, if they were injured on the job, their employers would pay their medical bills and enough of their wages to help them get by while they recovered. In the tragic event a worker dies, workers' compensation provides death benefits to spouses until they remarry and to children until they graduate college. However, over the last 2 decades, big businesses and insurance companies have successfully dismantled the workers' compensation system across the country, reducing benefits and creating arbitrary time limits. All the while, employers have found someone else to foot the bill for workplace accidents, the American taxpayers, through Social Security, disability insurance, Medicare, and Medicaid. We see it all the time at our Immigrant Worker Center. Workers battle insurance companies for years to get the care and surgeries they need to recover and could never navigate the system without the support of lawyers for those lucky enough to have one. For those who are not so lucky, they're at the mercy of a system rigged against them. Now, in the time of COVID-19, this trend continues as employers are already claiming their workers are contracting the virus through community rather than workplace exposure. Throughout March, April, and May, thousands of essential workers in Massachusetts have become ill and even died as a result of their exposure to COVID-19 on the job. These workers and their families should be assured that they will get the workers' compensation they deserve, but employers are already trying to undermine these benefits. Occupational presumption legislation would ensure that any essential worker reporting to work outside their home who contracts coronavirus is presumed to have gotten it from exposure at work. This will help ensure that infected essential workers don't have to use their paid time off or sick time to quarantine, treat, or recover from the coronavirus. It will provide support for workers who don't have access to expanded paid sick time, and in some cases, the virus's impact can have longer-term effects in which workers who do qualify for sick time may also need workers' compensation benefits to fully recover. And for workers who have no health insurance, workers' compensation can pay for the costs to treat COVID-19. Many states have already taken action. Massachusetts is behind, but there are a few bills filed in the State House that provide occupational presumption for healthcare workers, first responders, and public employees. MassCosh supports all of these, but is particularly supportive of HT 5070, which Darlene mentioned earlier, which covers all essential workers. It's clear that workplace exposure is a major way our residents are becoming ill and spreading the virus to their families and communities, yet we have failed to fully protect these workers, often with tragic results. In addition, racial and economic injustices in work and healthcare are exacerbated by the pandemic, putting temp workers, low-wage workers, workers of color, and immigrant workers at particular risk. It's important to note that the harm this has caused workers was not inevitable, and it did not happen by accident. OSHA, the federal agency charged with protecting workers, has largely been missing in action during the pandemic. Worse, the Baker administration has provided only limited support to essential workers and has chosen not to inspect and enforce safe working conditions. Governor Baker has profoundly failed workers that have been working for the last 2 months, and now, with his reopening plan, is failing to robustly protect everyone who's going back to work. Let's not forget that prevention comes first. Massachusetts workers, essential and non-essential, deserve safe workplaces. But for those who've already fallen ill and for those who will, workers' comp is critical. We need to make sure they get it. Thank you.
Thank you. Thank you. Under 40 seconds, you got 40 seconds left, Jody. I'm going to give that to someone else. Okay, good job. I would like to now acknowledge Jim Cabarjo, who is the political director of UFCW Local 1445. You now have the floor.
Great. Thank you, counselors. Thank you for allowing me to testify at today's hearing. Anything and everything that can be done to improve the safety of working men and women during this pandemic must be done, and I thank you for holding this hearing. My name is Jim Carvalho, and I am Political Director for United Food and Commercial Workers, Local 1445. Our union represents workers across a number of locations in Boston, from the TD Garden to some meatpacking plants, the Macy's at Downtown Crossing, and the Stop and Shop grocery stores. Yeah. Our members at Stop and Shop have been working tirelessly from the start of the pandemic, serving our community. They have continued to go into work for each shift despite the increased risk of exposure in order to help provide a vital function for the city. Grocery workers have faced a unique and dangerous working environment since the beginning. The old saying goes that people got to eat, and that's true whether during normalcy or in the midst of a pandemic. This, unfortunately, means that grocery workers are potentially exposed to every single member of the public, whether they are healthy or sick. While some workers may be fortunate enough to encounter a more controlled and limited population when going to work at, say, an office building, any member of the public at any time can walk into a grocery store. Our members at Stop and Shop have been proud to help our communities during this difficult time. And while thankfully the governor, through executive order, has implemented many safety measures and procedures to help protect these workers facing constant and changing exposure, more can still be done. My fellow panelists have advocated for workers' compensation for this disease, and I wholeheartedly agree. While we were able to bargain for 2 additional weeks of paid sick time for our members, we still do not yet know the long-term effects of this disease. A few more measures that could still be implemented are things like further limiting the total number of customers allowed in grocery stores at one time, access to more and better PPE, as many others have always mentioned, and also requiring enforcement of customers wearing masks while entering the stores. This last example is of particular concern to our members. While the governor did issue an order requiring the public to wear face masks, it does allow those with health conditions to be exempt from wearing the mask if they cannot. While this exemption is fine for people with underlying health and breathing conditions, managers at grocery stores have used this as a pass for asking any customer not to enter the store if they are wearing a mask. Some people may have legitimate health reasons not to wear a mask, but I am sure that that is only a small fraction of the customers entering the store who are not wearing these masks. Stop and Shop is not requiring the store managers to ask anyone about it, and the responsibility of it should not fall on our members. We believe that it should be a requirement for grocery stores and retail stores once they've reopened to have a paid security employee stationed at each entrance to not only track customer limits, but also enforce mask wearing. We have unfortunately seen many of our members already exposed to the virus, and they need further protection by making sure every single person possible is wearing a mask while shopping. And the use of security can further protect our members, where we have unfortunately seen actual violent responses from customers against our members when customers have been asked to either wear a mask or maintain social distancing from our members. So this is a double threat for our members. They are exposed to the virus, obviously, but then also they have faced physical violence from customers when they've asked them to do something as little as keeping 6 feet apart from themselves. Thank you again for holding this hearing, and please, of course, let me know if you have any questions or if there's anything I can help you with. Thank you.
Thank you, Jim. Thank you so much. I'm now going to move on to Henry DeGroot. You now have the floor, from Executive Director of the Boston Independent Drivers Guild.
Hi, my name is Henry DeGroot, and I'm an Uber and Lyft driver and an organizer with the Boston Independent Drivers Guild. And I want to thank the Boston City Council for the opportunity and for giving drivers a voice on this important issue. Drivers throughout this pandemic have been continuing to deliver passengers, and especially a lot of our rideshare drivers have switched to delivering food or groceries, and so have really been providing essential services. And we definitely want to extend our support to the issue of occupational presumption. It's very powerful testimony we're hearing this morning. But I am concerned that, as with other worker rights, employee rights, that drivers, because we are misclassified, wouldn't actually be able to access this. And so this has been a big issue that we have been taking on, is the idea is misclassification. Just in short, we're classified as independent contractors, even though we're absolutely essential to Uber and Lyft. There's no drive or no ride or delivery that takes place without an Uber driver or a Lyft driver. And misclassification kills. Drivers at the beginning of the pandemic had to make the decision whether to go out and risk their lives without access to PPE, or if they have a pre-existing condition, or to stay home without pay because we don't have access to paid sick leave. And we had to wait a long time for the CARES Act to come into effect. And so we've been incredibly disappointed with the Attorney General, Maura Healey, because Massachusetts actually has the strongest law against misclassification, MGL Chapter 149, Section 148B, so strong that California copied it in order to rein in the rideshare giants. And the Attorney General has absolutely refused to take action directly. The only action that she's taken has been to the benefit of one of her major political donors, the attorney Shannon Liz Reardon. And it's really been leaving drivers in the dark. So we want to support the occupational presumption. But for drivers, what we need from the Boston City Council is what would be excellent would be to pass a resolution in favor of or calling on Maura Healey to take direct action against Uber and Lyft and do her job by enforcing this amazing law that we've had on the books for 16 years that has never been enforced for drivers, so that drivers can get basic employee rights like minimum wage, paid sick time, overtime, and we'll be able to access something like occupational presumption. Now, I'm not familiar. It's possible that it would apply to independent contractors, but my guess is that, like most other rights, it wouldn't. So I'm happy to answer any questions, and it's great to see a lot of friends on this on this hearing. So thank you.
Thank you, Henry. Thank you. I am now going to invite Roxana Rivera, from the director of SEIU 32BJ, Local 615. You now have the floor.
Thank you. Thank you, counselors and panelists for having me here today. I'm Roxana Rivera. I'm the Vice President of the Service Employees International Union, Local 32BJ. We represent 20,000 largely contracted cleaners and security officers across Massachusetts and in Boston. We largely represent, our workforce work for contractors, and they clean commercial office space. They clean universities and colleges and airports and at airports. And our membership have been seen as essential workers in this pandemic. Hundreds of workers have, even though there has been less traffic given the stay-at-home order, we have hundreds of workers that have contracted the virus at work. And we also have, unfortunately, had a number of our members actually pass away due to contracting the virus in the past weeks. One of the most important area that we've been advocating for is the issue of safe working conditions. And in light of this pandemic, as we think about reopening the buildings and institutions, we're concerned about just the level of, like many, the proper PPE for workers, and also that it be appropriate to what people are doing. So, for example, cleaners, at times have been the folks that have been asked to clean a certain area where there has been someone that has tested positive, and they're coming in after. So one of the first instances in March that we had was with the student at UMass that had tested positive for COVID-19, and our contracted cleaners were asked to clean, and at that point without the appropriate PPE. And so I hope that we've learned in the past weeks about what it means to, as colleges, universities, and commercial office buildings and airports be repopulated, that really we need the proper PPE so that there's less workers contracting the virus. Because again, hundreds of already, even with less traffic. So if you're talking about more traffic, it's more of a concern. We also, the other issue is social distancing. We've encouraged employers to basically have touchless ways in which people can clock in and clock out of work, that they can have staggered shifts and breaks. But again, because they work largely for contractors, what we need is building owners and the colleges, universities, and the airports to require these types of practices, right? And the other thing is that it is interesting as we see the state reopening. Some of the requests that have come from some of the employers of which our members work for has been, they want workers to sign a letter that says that they are COVID free. Yet what is concerning to us is that that building owners still don't have, and institutions, social distancing policies or protocols. About how their own use control of their common space, for example, inside a building, elevators, stairwells, and then even thinking about outside building spaces, right outside of the building, social distancing around traffic flow, because those are also put workers and the general public at more exposure. And so yet they want to guarantee that workers that are coming to the building clean are COVID free, yet then, they are, if they don't have certain protocols and policies in place, then, workers are obviously at greater risk. And so we want building owners, obviously, and institutions to have policies and protocols in place around the social distancing. And lastly is just having, fair standards for these workers, because again, that essential workers, again, if these buildings are being repopulated, the colleges are being repopulated, that, that all essential workers, have access to testing, and also that they are granted essential pay, quarantine pay, all those, because they do not have that now. And so, so I just thank you all for listening to my testimony today. Thank you.
Thank you. Thank you. I am now going to open it up to my colleagues to ask their questions. And because I neglected to introduce, to give them an opportunity for opening remarks, Councilor Breeden and Councilor Flynn, is it okay for us to go to our colleagues for opening remarks?
Absolutely.
Yes?
Yep.
Councilor Flynn, is that okay? Yes. I'm the chair and I'm going to say that's okay. And we're going to move forward with that in mind. So I'd like to invite Councilor Bach from District 8. You now have the floor. If you have opening remarks and questions, please do so now. Thank you.
Thank you so much, Madam Chair. I want to be very brief and just say that I think this is such an important conversation. And I think I've really appreciated all the concrete detail that the folks on the panel have provided, because to me, it seems like this is what our essential workers need from us, right? It's not applause at 7 p.m. on a Friday, nice as that is. It's not, signs in our windows, like it's protections for themselves and their families. And so I definitely want to figure out how I can be helpful on this, and appreciate the really concrete detail everyone's provided. But I know we have lots of folks here and lots of colleagues, so I'll just stop there for now.
Thank you, Councilor Bach. Councilor O'Malley from District 6, you now have the floor.
Is he there?
And can you guys hear me? Am I here?
We can hear you.
Okay. Councilor O'Malley, if you're with us, you now have the floor. And if not, I'm going to move on to Councilor Michael Flaherty at large, you now have the floor.
Thank you, Madam Chair. Hopefully everyone can hear me. I want to thank you for hosting this hearing and thank the lead sponsors, both Councilor Braden and Councilor Flynn for their role. There is, as we all know, there's legislation at the State House regarding emergency hazard health duty. And I'm confident that our colleagues up at the State House are working hard to ensure that all of our first line essential workers are protected and remain safe at work. I know there's been ongoing discussions around the occupational presumption, obviously, which this body supports. So I'm very happy to have this discussion. Happy to hear from those that know it better than we do, which were our panelists. Obviously, it's important to have all the stakeholders come together to have this conversation around a critical issue. And to all the essential workers listening, please know that I am grateful. I know that my colleagues in the Boston City Council are grateful for all of your work. We support you, and we're here to advocate for you and for all of your needs. Thank you. Keep up the great work. We need you. This isn't over yet, and hope to God it doesn't come back. But if it does, we want to be in the best position to handle it, and it's going to be our frontline workers that are going to help us get through it. Thank you, and God bless.
Thank you, Councilor Flaherty. I'd like to just go back to Councilor O'Malley from District 6. I understand that you are still here, but you might be muted. Okay, so we'll come back to you. Okay, I'd like to now move on to at-large Councilor Michelle Wu. You now have the floor.
Thank you, Madam Chair Mejia, and thank you to all the panelists for obviously what you said today and all the information and the clear direction you're giving us, but also to you for representing so many members who are keeping us all alive and healthy and fed and stable right now. This is really what keeps me up at night, thinking about all the families who are affected because someone is an essential worker, and we are nowhere near doing our part to keep you safe right now. So whatever I could do to follow the leadership of the sponsors and the chair and other colleagues who are here, we're looking forward to making sure that this is taken care of, because this is going to be an issue for a while yet. And far after the public health crisis has passed, we will still be addressing many other impacts that could be far worse if we don't make sure people are protected in this moment. So thank you for your time and your leadership. Thank you, Madam Chair.
Thank you, Councilor Wu. I'd like to now call Councilor Andrea Campbell, District 4. You now have the floor. Councilor Campbell, if you're still with us, you now have the floor and you are on mute. And we'll come back to you. And I know that Councilor Asabi George let us know that she was going to be jumping on a call at 11 and would be coming back. So I'm going to move on to Council President, District 7, Councilor Kim Janey. You now have the floor.
Hi, thank you so much, Madam Chair. Thank you for hosting this really important conversation. I want to thank the makers, Councilor Braden and Councilor Flynn, for their leadership in this space. This is a very important issue, how we support our workers and making sure that they are safe, particularly those who have been working during the pandemic as frontline workers. I'm here to support that effort. I've heard the amazing testimony from this panel. Very grateful to have your expertise, lending your voice to this conversation. Would love to continue to listen how we can be supportive to workers as they do so much for us. They're working hard to make sure that we're safe, and it's up to us to make sure that we work hard to make sure that they're safe. So don't really have a lot of questions at this time, but want to make sure that we're doing all that we can to support workers on the front line. Thank you, Madam Chair, and thank you again to the makers, and thank you to the panel.
Thank you, Council President Kim Janey, District 7. And before I turn it over to Councilor Braden and Flynn, the makers of this hearing, I would just like to offer just a few quick remarks that I have always known that our essential workers were already feeling the impact of what it's like to go unheard and unseen, and in many ways disregarded. And so I do believe that now, in the time of COVID, we need to even be even more vigilant in ensuring that the voices of those who are on the front lines are heard and valued and respected. I often talk about my mom, who is 71 years old and too poor to retire because she never had union representation. She's a low-wage food handler, and I see firsthand what a difference a union would have made in her life if she had representation. So I applaud everyone who is here fighting on behalf of our frontline workers, and here to not only support, but to take the lead and the direction from you on how we as a council can support your efforts. So I'm gonna now kick it over to Councillor Braden for any questions.
Councillor Mejia. Just generally for the panel, your experience with dealing with different employers, I'd like a better understanding of what the industries, the different industries that you're working in, and how employers are working with you as union representatives or employee representatives when a worker gets sick with COVID symptoms. Do they have protocols in place, or and what's your access to protective equipment, personal protective equipment? Does anyone like to answer that question?
So I think the way, Donna Kelly has raised her hand. I'm just curious. This is a process question. I'm wondering if the panelists can first answer the questions. And if you, Jim, I see your hand is up. Okay, so Jim, you now have the floor.
Yep. Can you guys hear me?
Yes.
So we represent workers at Stop and Shop, but so I can only speak to our experience with our employer. Obviously, there's thousands of non-union workers at other grocery chains in the city and across the state. Thankfully, in that regard, we were able to work with Stop and Shop pretty early on about kind of the safety measures. We work with them about securing masks for the members, installing the plexiglass shields at the registers, and even before a lot of these executive orders at the governor's office had implemented, we had worked with them case by case, saying this individual was just scared of going to work, so they're taking kind of unofficial leaves of absences, or they could take their vacation time if they wanted to. And then, thankfully, if someone is sick, we were able to secure and bargain for an additional 2 weeks paid sick time that doesn't use their regular sick time if they did become sick. And what the company does, if somebody does become sick in a store and they have a confirmed case, they actually go back and review video of the last time that person had worked in the store, and kind of track all the interactions with their coworkers, and then they'll have people that have kind of interacted closely with that individual quarantine themselves as part of that paid sick time, those 2 additional weeks as well. So thankfully, us working with the company as the people's representative, we're able to kind of secure some of those safety measures. But obviously, it's a different case, I think, for a lot of the non-union grocery store workers.
Thank you. Thank you for that, Jim. I'm now going to go to Filaine. You now have the floor.
Hi, thank you. To answer the question regarding how the different, and in our sector would be the different hospitals have really applied or recognized the workers' comp, or the claims that are being put in. I would say, unfortunately, it has been disheartening that it's really been all over the place. I mean, some of our largest employers and systems have made the decision to again deny or even dissuade, and these are large Boston systems. I hate to say it, but with Boston Medical Center, for example. We've had issues over on the Steward side, which our sister has spoken about as well. There are places where they have paid for COVID and COVID-related claims. And I will lift up one employer that made the decision early on, for our members at, Cooley Dickinson, Faulkner Hospital. These are partners facilities. They've paid and not out of an employee's time. And so unfortunately, while it's disheartening to hear the other responses, what it's done is pitted, stories against each other. And at this time, we should have one voice around healthcare and how we protect our workers. On the issue of the PPE, it has been quite scary to hear about the issue of the decontamination of N95 masks. We have put out a statement that, unless there is some sort of crisis mode, that, as our sister said, even the manufacturers are not allowing the reuse of masks in the way that they are happening. These masks are coming back faulty. There are smells to them. They're detaching. And so, midway through helping to deliver care, you're dealing with this mask issue. And that, unfortunately, has been universal where decontaminations are happening. And so, unfortunately, that's not where we find stories pitting against each other. Actually, we're hearing the story sounding the same in places where decontamination of N95s are being done. Thank you.
Thank you. Thank you, Filaine. I'm now going to go to Ellen McNinnis. Please, you now have the floor.
Thank you, Councilor Mejia. I have something to show you all. This is an N95 that I wore for 12 hours. Well, I took it off to have a bite to eat in the middle of the night, but it's almost 13 hours by the time I was done Monday night. So I can tell you that there were little rust marks next to the staples right there where I probably perspired. There's right down here in the corner is some sort of organic material that has turned brown over the past 48 hours. The shape of this metal is now deformed, and the mask is uneven. If I wore this again, this would not give me the protection that I needed. And yet, had I followed the hospital's directive, I would have submitted this for a cleaning with some hydrogen peroxide, and up to 10 times I'd have to do that. And even after airing out, when you put a mask on after it's been cleaned with hydrogen peroxide, you get this sort of burning in your throat, my eyes water. It's just very unpleasant. I find it annoying that in a country where a Ford F-150 truck can, from beginning to end, takes about 20 hours to manufacture. So Ford can turn out something as complicated as an F-150 pickup truck in 20 hours. And yet we can't produce enough life-saving equipment for those of us who are taking care of COVID patients and suspected COVID patients. This is absurd. This is a disgrace. And here's the deal. I think this has happened because hospitals know we're going to take care of our patients, whether we have this equipment or not. There's none of us who are not going to go into a room and take care of a patient. We'll do the best we can. My boss told us a few weeks ago, if you have ponchos or raincoats, you ought to be ready to bring them in because we're going to run out of gowns. That was about 2 weeks before Stewart donated 50,000 gowns to the state, which don't tell me for 1 minute that wasn't a publicity stunt. And don't tell me for 1 minute that they didn't engineer some sort of a tax deduction so that they could do that. It is not in the hospitals, the employer's best interest to protect us because they know we're going to do the work anyway. I think what we need to do is hold these companies responsible. In the same city where where we're being crammed on buses, where nursing assistants and people who care for our environment are being crammed on buses and not provided good PPE. You know, right 2 miles down the road from St. Elizabeth's, we have Partners Healthcare, which is providing PPE for everybody, and they are providing alternative housing and help with childcare, and they're not giving people a hard time about being paid when they're out sick. Everybody that I've worked with who's been out sick has had to use their own paid time off. And it just sticks in the craw to think that this company is accepting government bailouts and then pocketing some money in the meantime. And a lot of these hospitals are self-insured. So when you talk about workers' compensation, you're talking about the hospital's own money. So it's in their best interest, as previously, I think Jody mentioned this, it's in their best interest to get people off their private, the private payroll and onto public payroll, push people onto unemployment and onto SSDI and Medicare and Medicaid. The hospitals, the employers do not want to take responsibility for this. And this is I would say it's even more so in the for-profit sector of healthcare. I think what we need support from our elected officials. I know Liz is very, very familiar with this. We need support from our elected officials in our ongoing battle to make patients and those of us who are caring for patients safe. Thank you.
Thank you. Thank you for that. I don't see any other hands up for to answer any outstanding questions. Liz, do you have any other questions, or could I move on to Councillor Flynn? Do you have any follow-ups, Councillor Braden?
Move on to Councillor Flynn for now. I have another question, but I'll come back to it later.
Yeah, okay. So Councillor Flynn, you now have the floor.
Thank you, Councillor Mejia. Just wanted to follow up on some of the comments made earlier, but one point worth pointing out, as it relates to healthcare, we also see many hospitals are self-insured, pitting them against their own employees at times with regards to workers' comp claims as well, is something we've noticed. And, I know Ellen was talking about it, but with limited PPE, failure to provide testing, and even communicating those test results to the healthcare workers, in a long delay as well, is having a tremendous impact. But I know Donna Kelly is also on the line from Mass Nurses, and our nurses are on the front lines of this pandemic. They don't have the necessary equipment to do their job, but they're going in every day in fighting for the most in need people, in our seniors and persons with disability, the most sick in our society. Along with the other workers, as Jim was saying, our supermarket workers, our cleaners. This is a pandemic. It's impacting everybody. It's especially impacting the frontline workers that are out saving lives, and they deserve fairness. But I was just wondering if Donna is still on from the Mass Nurses. I don't know if she wanted to weigh in too before she had to leave. I know she may have to leave, but I just want to see if Donna is still on from the Mass Nurses Association.
Thanks so much, Councillor Flynn. Yes, I am.
Okay.
Just very briefly, I think Ellen really was eloquent, as well as the other speakers, on what we're seeing. It's inconsistent, unfortunately. What we're seeing is there are some people, some institutions that are doing a very good job at it. But however, the majority need the help of not only the Boston City Council, but the legislature. The legislation has to definitely pass presumption of the occupational exposure. There's no two ways around this. It's not like anybody has been out and about. The incident of the viral load transmission is highest in that setting of being face to face with individuals. And as Ellen so eloquently put it, for the longest time, we did not have people in PPE. We did not have people in masks at the grocery store. We did not have people in masks within the hospitals caring for the sickest of the sick patients. So I applaud everyone on the Boston City Council for your work and taking the initiative to do this. You are at the forefront of this, and you are ahead of all of the other cities and towns in Massachusetts. So I thank you all so very much for your hard work. So thank you very much, Councilman Flynn.
Thank you, Donna. And I just wanted to let people know that the City Council on May 14th sent a letter to state legislators in support of the various proposed legislation in support of our workers, our frontline workers. But again, just want to thank you for the tremendous work you're doing, saving lives. But as a society, we need to be there for you as you're on the front lines for us. I don't have any more questions, Councilor Mejia. I don't know if Councilor Braden still had another follow-up, so I'd like to, if with your permission, turn it back over to Councilor Braden if she wants to follow up.
Well, let me find out. You guys are taking over my chairmanship here. Yeah, and of course. Go ahead. I'm teasing you both. Go ahead, Councilor.
Thank you, Chair Mejia. Thank you so much.
Yes.
We are still in a public health emergency in Boston and in Massachusetts. We are still about 4th in the country in terms of tested positive cases. So the way I like to talk about it is we are at the end of the beginning. We are not at the end of this thing. It is very concerning to me that the media and many commentators and the general public think it's over. And I'm would be interested to hear from you worker representatives about how you're working to educate your workers and the general public about this, the danger is still there, and that we still need to be vigilant. We still need to insist that our workers have protective equipment, and we still need to ensure as many people as possible wear masks when they're out in public. And we also need to ensure social distancing. And I just don't know. I think it's a challenge for all of us to try and get the messaging right, but I'm curious to hear from you folks in the field about how that's going. There's Jody has their hand up.
Yes, so I'm gonna go to Jody, and then I see Ellen has her hand up, and then I also want to be mindful that we have public testimony and our counselor colleagues who may have questions, and the goal is to try to end by 12. So I'm gonna start now managing this, the time crunch that we have here, and I'm gonna go to Jody. If you have 2 minutes for your response, and I'm being generous with 2 minutes, but I'm gonna start timing you now.
Thank you so much. I just wanted to say a couple of things. One is we're hearing from a lot of workers, especially as this reopening phase 1 is underway, about what their rights are, how health and safety standards will be enforced. And we at MassCosh are holding a virtual town hall this Thursday, May 28th. At 5 p.m. and you can find out more information on our website. And our goal is to be able to answer people's questions and make sure they have all the information they need to be able to stand up for their rights. I did want to raise one more question, which I think is one more issue really important moving forward, and that is of data. Collecting data on COVID-19 cases is really critical, and there's been a major glaring omission, and that is data on the occupation, industry, and employer. Workplace exposure is a main way that workers, their families, and the community are spreading this virus, yet we have no way with the data that's being collected to be able to identify which work groups are being most affected outside of unions who are tracking this information and union members, which we are incredibly thankful for our partners in that, but we really need to be able to better understand which work groups, and more importantly, as we reopen the state, which employers, so that we can identify workplace outbreaks and take action swiftly and completely. So we're really hoping to see something like that happen moving forward.
Thank you. Thank you for that, Jody. I am going to now reset the timer, and I am going to ask Ellen for some remarks. If you want to answer that, address that.
Thank you, Chair Mejia. I know I have a lot to say here.
And I'm going to keep it 2 minutes.
I understand that. So I just want to point out that yesterday, 8 COVID positive patients were admitted to the ICU at St. Elizabeth's.
Mm.
We are still seeing COVID positive patients. I believe we will begin to see that trend down. I would like to say we cannot underestimate the impact of this pandemic on those of us who provide support services for behavioral health patients.
Mm.
We have seen a tremendous surge in folks presenting to the emergency department for treatment of mental health issues and addiction issues. We need to find a way to get resources to these folks. We have highly acute people who have been stressed, who have suffered losses, who have not been compliant with their medications, either because they couldn't access them or they were too impacted in other areas of their life to do so. Patients who have not been seeing their therapists or their counselors. I think that this is a population that will require nearly as many resources as our physically ill COVID patients have. I think that this will be the silent pandemic. These are the folks that we won't see. As a healthcare provider in Boston, I'm grateful. We have a pretty good safety net. We have the best team. We have emergency departments. We have mass mental. We have a lot of resources for these people. I don't think it'll be enough. I think that on a good day, some folks are living very close to the edge. And when you throw something like this at them, they're just tremendously impacted. That being said, I think we need to go through with this, remembering that there is a world of hurt out there. There are people who are really struggling. Thank you.
Thank you, Ellen. Thank you so much. I am now going to recognize Roxana Rivera. You now have the floor.
Thank you. Just to answer your question, right when the pandemic hit, one of the, where we felt it was really important, it was to engage directly with employers about when we got calls from members that they had tested positive, really going back to those employers and to those work sites to understand who else needed to be quarantined. And unfortunately, it was initially met with resistance. So even, for example, at institutions like Boston University, for example, and it took really us being just repetitive and really trying for folks to push for even them implementing how people clocked in and clocked out, staggering the breaks, giving them more space to take their breaks rather than a small break room. Those types of suggestions, right? Finally, they took in many instances, and that we think has saved a lot of other people from contracting the virus in the work site. And I think that, that was happening as there was less traffic at these institutions like the airport, like colleges and universities, and big buildings like, for example, the Prudential. And so we have forth recommendations to the governor's office on, as far as like concrete steps that can be taken for the commercial office building, for the airport, for the higher education institutions. And we have reiterated those same recommendations to the building owners and to the higher education institutions. Because again, our biggest concern is this repopulation. Because if we were already, and they, these institutions obviously weren't prepared for what type, what type of protocols they needed to have in place for both just the proper protective equipment and also social protocols. Workers now have seen the value of that as they have seen coworkers contract the virus. And so, but again, I think that going forward here with the reopening, we really need to reiterate these things in these recommendations. So whatever support that can be had from governmental bodies, this is really important to encourage the private sector and public, sector to take these recommendations seriously.
Thank you. Thank you for that. Before we move on, I just wanted to loop back around and see if Councillor Matt O'Malley from District 6 is still with us. And I know that Councillor Andrea Campbell from District 4, if you are with us. And no, okay. So I'm going to now ask, unless if my colleagues have a question they'd like to ask, if you could raise your blue hand. Okay, Councillor Breeden, you now have the floor.
I'd like to follow up on Roxana's comments. Just curious to see that the universities are looking at reopening. Boston College is proposing to bring their students back on campus on by August 31st. I'm just curious to know what conversations you folks have been in with our colleges of higher education, our universities and colleges in Boston, about their plans and how they're going to protect their workforce, how that's going.
So we have multiple things to talk to higher education, because partially is there is a mixed response from different universities about how they will reopen. So some of for example, Harvard is talking about actually doing layoffs, right? And so versus Boston College saying that they're going to fully reopen. And so we are engaging with each of those institutions to understand what they're planning on doing in the fall, whether they are opening, and how many students they are going to be receiving, to understand the population, and then talking to them about, based on what they're doing, like how is it that what social distancing protocols that they're going to have for their common spaces, for their outdoor spaces, inside the buildings, because that's going to be key to basically lowering the exposure for obviously workers, but then the general public as well.
I think we have a long way to go in terms of preparation for that repopulating of our colleges going forward. Thank you for that. Anyone else? No. Thank you, Chair Mejia.
Thank you, Councillor Breeden, and thank you to all the panelists who have answered so far. I'm just curious, if there are no other questions or comments from my colleagues, I'd like to begin public testimony, if that's okay, Councillor Flynn and Councillor Breeden.
That's fine.
Oh, yes, Councillor Campbell is on the scene. Councillor Campbell from District 4, you now have the floor.
Yeah, first of all, I just wanted to, I know this was going long, and I put my listening ears on, took a lot of notes, and I do want to get to public testimony. I always want to be respectful of people's time when they participate, particularly during the pandemic. But I had to just, of course, thank the makers again for putting forth the hearing order on this, all of the panelists who showed up, and of course, some had to jump early. Critically important to me, my district, as you know, Madam Chair, is largely Dorchester and Mattapan, predominantly a district of color. By some metrics, one of the poorest in the city of Boston. We have a lot of the essential workers who are going to work every single day. Just this morning, I actually had a call with a Mattapan resident who is going above and beyond. She does PCA work, right? Caring for our elders during this time. And some of our elderly programs for our elders have been canceled. So these workers are not only at risk and out and about, but doing the best they can to protect themselves and the folks they care for. Their hours have been expanded. Now they're sort of 24/7 because of the programming that their clients would go to have been canceled. They don't get additional wages. They don't get additional benefits, right? There's nothing additional for them. There's no stimulus for them. So in addition to the presumption piece, which I think is absolutely important, no one should have to fight to prove that they were on the job and were exposed and have to go through a long, lengthy process. The onus should absolutely be on the other party. The additional layers that I think many of the panelists raised is the benefits, the pay, all those folks who are going without right now, and how important our advocacy is for our workers. So support everything that this hearing order stands for, any advocacy that I can do at the state or even the federal level. But most importantly, I think the advocacy around wages, benefits for those folks who are going above and beyond, not just, of course, equipment, that's important too, is also critically important. There are some categories of workers that are being left out of these stimulus conversations that I think absolutely need to be raised up. And my district is a reflection of those folks. So thank you, Councilor Mejia. Thank you again to all of the panelists and the work that you guys do every single day on the front lines. Appreciate you. So thank you, Councilor Braden, and thank you, Councilor Flynn.
Thank you, Councilor Campbell. I would like to, before we move on to public testimony, would like to ask the makers, Councilor Braden and Councilor Flynn, if you are ready to move on to public testimony.
Yes.
Yes, okay. So we're gonna start off, we're gonna move to public testimony, and we're going to ask Marianne Bray, you now have the floor. And you may be on mute. Or may not be on mute. Where are you? I thought I saw you earlier. Okay.
I know she's on.
Okay, so Marianne, if you're not ready to go just yet, I'm going to move on to our next public testimony and then come back to you. I'm going to move on to Dana. Dana, you now have the floor. It's good to see you.
Hey, how you doing? Thank you very much, Counselor. I'm honored, and I have nothing to add that our Representative Ellen hasn't already eloquently said, and Donna, our President. So thank you for conducting this hearing, and thank you also all the other leaders on this call.
Thank you. Thank you. I am now going to Marianne, are you back with us? I am now going to move on to CPA. Hi, Karen.
Hi.
You now have the floor.
All right. Thank you, Councilor Mejia, and thank you, Councilor Flynn and Breeden, for hosting this a hearing on this important issue. I just want to, on behalf of the Chinese Progressive Association, we're a community-based organization located in Chinatown, 28 Ash Street, but we serve Chinese Americans in the greater Boston area. And we just want to express the importance of occupational presumption, during this pandemic. And we, since the start of the pandemic, we've been hearing from, now it's been kind of more than 1,500, workers calling us on different issues, varying from unemployment to, PPE needs and testing, supportive services. And I can't emphasize, the importance of workers, feeling protected in order to return to work. I think that, a lot of workers are now being called to go back to work. We heard from, almost a dozen of workplaces, varying from supermarket workers, home care workers, retail workers, hotel workers. What do we do? During the pandemic, when we're considered as essential workers, we don't have, the PPE that's needed in order for us to feel safe. And how do we think that, reopening, would, having everything reopened, that we're going to feel protected? And what if, I get sick? And what if I get my family members sick? We even have people, not just the Chinese Progressive Association, but also, a lot of allied organizations, even asking for, we have a death in the family. What is your support in this? And, the only, for, low income folks, the only thing I know is there's about, I think, $250 from Social Security Administration. And I know that, with workers' comp, with this imperfection, but it also provides, death benefits for people who are impacted. So, for me, I just feel like, I think it's been, great panelists, had, covered the issue in depth about, how important it is and all the things that we're seeing. And I think we don't know what are the long-term impacts on people. We're talking about not just physiological, but psychological as well. So we need to make sure that, if you want, to have a society that cares for people, and because we are cared for right now, I have the luxury to work from home. I still have food. I have all the essential needs I do. It's because of the essential workers. I would say that not many of us share, those privileges. The workers are caring for us, and making sure that we have our essential needs met. We have to make sure the workers who are out there working are protected. And, I think Darlene said this, a better world is possible. And we have to start, by protecting the workers who's going to go, come back to work. We will not have an economy without workers. We will not have an economy unless the workers are protected. And I think that we also need to call on the governor together and say that he needs to take a stand for the workers.
Thank you.
They are also part of the, leaders in the industry and need to have a voice in how people can be protected. And what we are asking for is very basic things and reasonable. And so I want to thank you for, hosting this hearing and hearing from, the workers and recognizing the importance, of the essential workers. They're not just essential workers now, they have been essential workers every day. Yep. We need to turn around the situation where workers, who have the lowest pay, sustain the most injuries, are the lowest paying workers. And if we can't change that, at the very least, people should have the, feel more protected when they're going out to work. So, yeah.
Thank you. Thank you so much, Karen. Really do appreciate your passion and your testimony and uplifting the voices of all. I'm going to go. I see Marianne. Are you with us? You're back. Okay, great. You now have the floor.
I'm sorry, I got booted off Zoom. Maybe nobody wanted to hear me. Thank you. Thank you so much. I really appreciate it. And thank you for allowing us to be here. And I can't thank Councillor Flynn. He checks in all the time, and he's been a huge supporter of people on the front line. And Councillor Braden, she's just been fantastic. I know Ellen has her on speed dial. So your leadership, and thank you, Councillor Julia, thank you for hosting us. But and I think, we are very fortunate to have the strong leadership of Mayor Walsh and his team. But I think what Ellen said was right, is that we don't want to wait till a point where we have a picture of a crowded shuttle bus and then have to react to a situation that shouldn't exist at all, right? And we're so fortunate to have you all to call on, but I feel like this legislation and this is so needed, and leadership on this issue is so important right now. So I won't take up any more time. I know Ellen is just a fantastic speaker, so I think she has said most of everything I would say. But thank you, and I really appreciate Councilor Flynn is such a dear friend. So thank you all. Thanks everybody.
Thank you. Thank you. I would like to, before we move on, I would like to just ask if any of my colleagues would like to make any closing remarks. If you are interested, please raise your blue hand so we can recognize you before we wrap. I'd like to thank members of the public and to the panelists for their testimony. But again, before I close this hearing, does anyone have any closing remarks they wish to share? And if you do, please raise your blue hand. Okay, Councilor Breeden, you now have the floor.
Unmute myself. I really want to thank Councillor Flynn for co-sponsoring this once again, and Councillor Mejia for chairing this hearing, and also all of our panelists. It was really important and useful to hear from folks who are working on the front line to address these issues, who are cognizant of the risks that their workers are facing every day. And basically, just to emphasize that first and foremost, essential workers deserve to have safe workplaces, and they also deserve to have adequate personal protective equipment. And as we open up and repopulate our workspaces and things ramp back up, we have to be really cognizant of the fact that this public health emergency is ongoing. We do not have a treatment for this virus, and we do not have a vaccine. So until we have a vaccine in place, we have to be very cognizant of worker safety, personal safety, and we have to do everything we can to protect our essential workers from infection and possible death as a result of being exposed to this virus. So the issue of occupational presumption, to me, is a no-brainer. For folks who are dealing with the public and potentially exposed to a virus on a daily basis, this is a no-brainer. So I hope that we can get to a place where workers in the front line can be assured of the protections of workers' compensation, so that if they do fall ill, they do not lose wages, they're able to protect the security of their family, and that they are treated fairly. They are making incredible sacrifices. They have made incredible sacrifices. They have always been essential, and they have been even more essential in this crisis. So thank you so much for all your work. I hope that we can get to a place where this is recognized as something that's very important for our workers. And thank you all for your participation. Thank you.
Thank you. I'm not seeing any other blue hands. I would just like to end with my own reflections and just thanking again everyone for participating in this hearing. We have a responsibility and an opportunity to change the way we do business here in the city of Boston. I am committed to that work and working alongside each and every one of you. I wholeheartedly believe that those who are on the front line should be at the front and center of every conversation and every decision that is made. And so standing with you on this journey and looking forward to being a strong voice to ensure that those who are most impacted are being well taken care of today and beyond COVID-19, because we know that the fight is long and we have been at it, well, you have been at it a lot longer than us, but know that like Councilor Breeden said, this is just the beginning This is the beginning of the end, or the end of the beginning. This is not over. I'll just keep it like that. It is not over, and we have a lot of work to do, and really grateful to be working in partnership with Councilor Flynn and Breeden on this issue, and thank every single one of you for the panelists that spoke and those who gave public testimony, for raising the voices of those who are unable to speak today, but know that you're still being heard. So thank you so much. And I am very proud to say that we've ended this under 2 hours, and I would be remiss if I did not thank Central staff for their hard work and dedication and making sure that we have all of our technology in order, all of the panelists lined up. It is those who are working behind the scenes that are making this happen. So thank you again to Central staff for all your hard work. And thank you all. Enjoy the lovely weather, and let's keep on fighting. Thank you. Thank you so much.
Thank you, Councilor.
Yeah, and I think we just leave now. Oh, no, wait, I have to, this is now, we are now drawing this hearing to close. Thank you.
Thank you, Councillor Mejia. Thank you, Councillor Flynn.
Okay.
Thank you, Councilor Breeden. Thank you, Councilor Mejia. Thank you to all the panelists.
Thank you all. Thank you all our panelists.
Thank you.
Thank you, Central staff.
Thank you.
You're welcome, Counselor. Have a good day, everyone.
Thank you. We appreciate it.
Thanks so much. Bye-bye.